Hello, everyone. My name is Joy Wells, and today I'm going to be talking about the maternal health crisis. Imagine this: two women, both educated, both financially stable, and both excitedly awaiting the birth of their child. Yet one of them, simply because she is Black, is 3 to 4 times more likely to die from pregnancy related complications than the other. This is not a hypothetical scenario. This is the reality of maternal health in the United States. Good morning, everyone. My name is Joy, and today I want to talk about an issue that should concern all of us: the maternal health crisis disproportionately affecting Black women. It is an issue of race, medicine, and justice. Black women in the U.S. are dying at alarming rates during and after childbirth, not because of personal choices, but because of deeply ingrained structural racism within our healthcare system. For decades, the dominant narrative blamed Black mothers for their own poor health outcomes. We heard explanations like they don't seek prenatal care, they have unhealthy lifestyles, or college degree is more likely to die from pregnancy related complications than a white woman with only a high school diploma. Well, a Black woman with a college degree. That statistic alone shatters the myth that this is simply an issue of education or personal responsibility. The problem is systemic. For example, Serena Williams, her story highlights the dismissal of Black women and their health concerns, even with fame and, wealth and all of that. And I'm going to talk about that a little bit more. So, what's causing this crisis? The answer lies in structural racism. The policies, practices, and biases that are embedded in our healthcare system, according to Halu, structural racism creates barriers to quality care, increases chronic stress in Black women, and leads to delayed or inadequate medical treatment. Black women are less likely to be listened to by their doctors, more likely to have their pain dismissed, and less likely to receive life saving interventions in critical situations. So, like I was talking about, Serena Williams, one of the world's greatest athletes, a woman with access to the best healthcare money can buy. After giving birth to her daughter, she recognized the symptoms of a life-threatening pulmonary embolism. She told her doctors, but they dismissed her concerns. It wasn't until she insisted repeatedly that they finally conducted tests and she was right. Now, imagine a Black woman without Serena's status, resources, or confidence in self-advocacy. Imagine how many stories don't end in survival. How do we fix this? Some argue that part of the solution lies in decolonizing nursing education, teaching future healthcare providers to recognize and dismantle their biases. We need more Black healthcare professionals, better training for non Black providers, and policies that hold hospitals accountable for racial disparities in care. This is not just about medicine, it's about justice. Black mothers deserve to survive childbirth. Black children deserve to grow up with their mothers, and we healthcare providers, policymakers, and everyday citizens have a responsibility to change this reality. This is not just a call to action. This is not just a crisis, it is a call to action. And the question I leave with you today, well, for right now, is will we answer it? Today, we face a critical challenge. Sorry. Today, we face a challenge in maternal health, particularly for women of color. Black and Latina mothers experience disproportionately high rates of maternal mortality and morbidity. Yet, there is hope. Solutions already exist, and they're making a difference. Picture a world where every woman, no matter her race or income, feels secure and supported throughout her pregnancy and childbirth. This is not just a dream, it's an achievable reality. But to get there, we must take immediate action. Recommendation number one: expand access to prenatal and postnatal care. One of the most impactful ways to reduce maternal health disparities is expanding prenatal and postnatal care. Medicaid expansion has significantly improved maternal outcomes, especially for low income women. Studies show that Medicaid coverage leads to better access to care, reducing the risk of complications and maternal death. Expanding Medicaid nationwide is critical to ensure that all women, regardless of income, have opportunity for timely and comprehensive care. Recommendation number 2, empower community health workers. Another strategy is community health worker programs. These trained in, sorry, these trained individuals help pregnant women navigate healthcare systems, provide education, and offer emotional support. Research shows that community health workers effectively reduce health disparities, particularly in underserved populations. By integrating them into healthcare systems, we can offer personalized support that improves maternal outcomes, increases satisfaction, and reduces the hospital readmissions. Recommendation number 3, implicit bias training for healthcare workers. Addressing implicit bias in healthcare is also essential. Studies show that Black and Latina women often face discrimination or are not heard by healthcare providers, leading to poorer care. That's why implicit bias training is crucial. Providers must understand and address their biases to deliver equitable care for all. Programs like those from the March of Dimes are already working to help healthcare professionals better recognize their biases and improve patient care. Recommendation number 4, invest in doula and midwifery services. Doula and midwifery care are also vital. Studies confirm that doulas significantly reduce preterm births, C-sections, and maternal deaths. Programs like the Black Mamas Matter Alliance have expanded access to doula services, particularly for women of color, improving their maternal health outcomes. Doulas offer continuous emotional and physical support during labor and delivery, empowering women to make informed decisions and reduce stress. Recommendation number 5, advocate for policy change. Finally, we must push for bold policy changes that address the root causes of maternal health disparities. Comprehensive reforms such as paid family leave, living wages, and universal health care are crucial. Women who face financial instability are at higher risk for complications, and these policies can provide the stability they need for healthier pregnancies. Additionally, policies supporting housing, education, and access to nutrition are essential in promoting overall maternal health. Conclusion of a future where no mother is left behind. Together, these strategies from a robust, multi pronged approach to addressing maternal health disparities. The evidence is clear. Expanding access to care, supporting healthcare providers, and improving community based services can reduce disparities. However, we need systemic change, sustained funding, and dedication from policymakers, healthcare providers, and communities. Let's rise to this challenge and ensure that every woman, no matter her background, has access to the care and support she deserves. The future of maternal health is within reach, but only if we act now. Together, we can create a world where no mother has to fight for her life during childbirth. Now, I'm going to focus on the differences between Black and white mothers and the root causes of these disparities. So, you may be surprised to learn that despite significant advancements in healthcare, Black women are 3 to 4 times more likely to die from pregnancy related complications than white women in the US, which I stated earlier. This disparity is not just a statistic, it's a reflection of the systemic, structural, and deeply embedded inequalities that continue to plague our healthcare system. So, what's driving these disparities? First, let's address access to healthcare. Research consistently shows that Black women are less likely to have access to timely, quality prenatal care. Healthcare facilities in predominantly Black neighborhoods are often underfunded, leading to inadequate resources and subpar care. According to a report by the Centers for Disease Control and Prevention, or CDC, even when Black women have access to healthcare, they are often subjected to lower quality care, especially in areas with high levels of poverty and systemic racism. But access to healthcare alone doesn't explain the full picture. There are also social determinants of health, the broader social and economic factors that contribute to health outcomes. Poverty, unemployment, housing instability, and lack of access to education all disproportionately affect Black women. These factors lead to increased stress levels, limited ability to receive regular care, and overall worse health outcomes. In fact, chronic stress has likely been linked to negative birth outcomes, such as preterm birth and low birth weight. Studies have shown that Black women, even when they have higher socioeconomic status or education, still experience worse pregnancy outcomes than white women. This is partially due to the compounded stress of living in a society that is racially inequitable, which negatively impacts their physical health. Perhaps one of the most troubling factors contributing to maternal health disparities is racial bias and discrimination. Unconscious bias among healthcare providers plays a critical role in the unequal treatment of Black women. Research has shown that Black women are more likely to experience dismissal of their pain, delayed care, and even outright mistreatment when interacting with healthcare providers. A study by Howe showed that Black women often report feeling disrespected or ignored by their healthcare providers, which can affect their willingness to seek care and ultimately their health outcomes. Lastly, we must consider the role of historical inequities. The history of racism in the U.S. has created a healthcare system where Black women's lives have not been valued equally. This historical trauma is passed down generationally, leading to deeply ingrained mistrust in the healthcare system. Black women are often hesitant to seek care, fearing mistreatment or the belief that their concerns will not be taken seriously. This lack of trust leads to fewer Black women seeking out prenatal care or adhering to treatment recommendations, which ultimately contributes to poor health outcomes. To address this, to address these disparities, we need systemic change. We must improve access to quality care for Black women, train healthcare providers to recognize and counteract implicit bias, and tackle the social determinants of health, such as housing, education, and income inequality, that contribute to these disparities. We need to ensure that every woman, regardless of race, has the opportunity to receive the care and respect she deserves during one of the most vulnerable times in her life, pregnancy. In conclusion, the disparities in maternal health between Black and white women are not the result of individual choices or genetic differences. They are direct consequences of systemic racism, bias, and inequities that have been woven into the fabric of our healthcare system. The evidence is clear. If we want to improve the maternal health for Black women, we must address the root causes of these disparities and work towards a more just and equitable healthcare system for all. Thank you.